There's so many little things that go into that has an overriding philosophical drive, and it's just be nice to people. And it sounds simple. It sounds, you think, well, it can't be that simple. But if it is so simple, the question is, why don't more people do it? And it begins initially with the first contact with the person. You're going to hear from a person, the same person that you're going to see when you come through the front door. You're not going to be assigned a patient number. When you come through the door, we're going to be ready for you. We have a waiting room. You will rarely sit in it unless you show up early. We're always on time. We have a 5-minute rule. There's an emergency if we're later than 5 minutes from the beginning of your practice, okay? So initially, you come through the door, you're greeted by the same lady that spoke to you on the phone that made your appointment. There's no glass window divider. You're not handed a stack full of papers. And that's purposeful. It's not because we don't need that information. It's because I want you to tell me. I want to have that conversation with you. So you're going to briefly sit. We're going to be ready. We're going to be standing at the door, ready for you to come in. And we're going to begin this process of figuring out exactly what it is that you either desire or that you need. And all of that goes into, so what do you do when a guest is? You make them comfortable. You expect them. You make sure that you're on time. You're respectful of their time. You listen to them. You want to welcome them in, just as if you were going to have a conversation with them at your own house about something that's not medically related. You just so happen to be talking about things. We're going to get all that information. I'm not ever going to treat a stranger, meaning I'm going to know as much as I possibly can about you and your medical condition, any limitations or things that we need to be aware of before we begin. We want to take all the x-rays. We're going to review those with you. We're going to have a full discussion about what we find. Our job is to educate you about what it is that we see, tell you maybe what our recommendation is, and then, most importantly, back off and let you make your own decisions about your own health care. In other words, we are the dental health care providers, but it still is your health. And you're going to make the decision about what you do, when you do it, and how you do it.